Good afternoon, students. Welcome to the second class for today, which is on sexually transmitted infections. My name is Rachael Odususi of Virology Department, College of Medicine, University of Ibadan. So now we are looking at sexually transmitted infections or STIs, and I'm sure some of you are not new to this topic, but it is important that we talk about them because of their significant impacts on public health and how to prevent ourselves from getting infected via sexual intercourse. And the objectives to guide this class is you have a good overview of STIs, you identify causes of STIs, they'll be able to describe the symptoms and signs of STIs, and also to describe preventive measures for the transmission of STIs. So as the name implies, sexually transmitted infections, they are infections that are primarily transmitted via sexual intercourse. Although they can be transmitted via other means, but this class is focused on those ones that are primarily transmitted via sexual intercourse, and they are traditionally referred to as venereal diseases. And the primary site of infections of these infections, they are the mucous surfaces around the genital area, such as the penis, the vagina, the cervix. But as a result of people looking for means or to explore means in order to get sexual pleasures, they are beginning to involve other parts of the body in sexual engagement. And this advent has led to the discovery of what we call oral sex, anal sex, and making this part of the body susceptible to sexual infections. In Nigeria, not only in Nigeria, in many parts of the world, these STIs, they are of significant public health because they easily spread within the community, and the burden is on that individual. If you get infected, some do not have the means to seek medical intervention, and even some that have the means, the treatment might be ineffective against that pathogen. But it is important that we take care of ourselves and not engage in behaviors that can put you at risk of being infected. And the epidemic of STIs is driven by behavior such as having multiple sexual partners. You might think it's fun, but you are endangering your health. Having unprotected sexual contact with high-risk person. High-risk person can be homosexuals, can be commercial sex workers, or engaging in intravenous drug use by sharing contaminated instruments, needles, and the likes, and also via unsafe blood transfusion. That is why when blood are usually screened for these infections before they are transfused to individuals that need them. Now, STIs can be classified into two. One is etiological classification, and the second one is clinical classification. STIs are grouped into two: etiological classification, clinical classification. By etiological classification, this classification is based on the etiologic or the causative agent of STIs. That means it is classified based on the pathogen that cause these diseases. So this STI can be caused by bacterial, can be caused by viruses, can be caused by fungi, and also protozoals. They can cause STIs. So for starting with bacteria as a causative agent, they are small organisms. You can only see them with the aid of a microscope. And all bacteria, they have the same basic structure as shown in this picture. You can see the picture shows the basic features or structures of a bacteria. For a virus, using HIV as an example, They are for HIV virus, it is spherical in shape, and it has what you call envelope. Not all viruses have this envelope. The outer coat is called an envelope, but for HIV has what you call the envelope. And on that envelope, you have viral proteins that the viruses use to attach to the host that it infects. And these viruses, they must get inside a living cell before they can initiate infection. Outside the living cells, viruses are inert. They are inactive. But once they get inside the living cells, they'll be able to replicate, produce new viral particles, and cause infections. For fungus, they are distinct from plants and animals, and they cause infections, especially in people whose immunity is compromised. Maybe people that have underlying health conditions, or people suffering from severe infections, such as AIDS patients. So bacterial causes of STIs. Number one, we have Neisseria gonorrhea, which causes gonorrhea. You have Chlamydia trachomatis, which causes non-gonococcal urethritis or cervicitis. Whenever you come across the word urethritis or cervicitis or that hepatitis, any word that ends with TIS is talking about the inflammation of that body part. So non-gonococcal urethritis or cervicitis is talking about inflammation of the urethra or inflammation of the cervix. I also have lymphogranuloma venereum caused by Chlamydia trachomatis. You also have uriplasma urealyticum that causes non-gonococcal urethritis or cervicitis. You have Haemophilus ducreyi that causes chancroid. You have Treponema pallidum that causes syphilis. You have Calimactobacterium granulomatis that causes granuloma inguinale, and Gardnerella vaginalis that causes bacterial vaginosis. So all the examples listed here, they are bacterial causes of STIs, the causative agent, and the disease they cause. For a gonorrhea, it is caused by Neisseria gonorrhea, which is a bacterial. It is a diplococcus. That means it appears in two. It is a gram-negative and rod-like, and it infects epithelial cells that are found in the male urethral, cervix in female, also oropharynx and conjunctiva of the eye. That is a part that shows symptoms of gonorrheal infections. So you have non-gonococcal urethritis or cervicitis. It is characterized by whitish urethral discharge while the individual is straining, and the person often experiences difficulty in passing urine, and it has the same complication as gonococcal urethritis. You can see the whitish discharge emitting from the genital area. This is chancroid. Chancroid is characterized by multiple necrotic dirty ulcers around the genitals, and if care is not taken, it can lead to amputation of the genitals. That means the part infected, because the sores will keep multiplying, so you have too many open sores or open wounds around the genitals, and might be advised that that part should be cut off. This is syphilis. Syphilis is characterized by single painless ulcer. Although it can heal on its own, but it tends to reappear because it undergoes what we call latent stage. At that latent stage, the pathogen is still there, but it's just not causing much infection. But there are conditions that can reactivate this pathogen and to now come to the stage where to now manifest infection again. So the examples we have talked about, they are STIs that are caused by bacteria. Now let's look at STIs that are caused by viruses. The notable one, we have the HIV, and which the advanced stage of HIV infection that will lead to acquired immune deficiency syndrome, which is AIDS. You have herpes simplex virus that causes genital herpes. You have papilloma virus, that's human papilloma virus, causes genital warts, and if treatment is not taken, it can lead to cervical cancer. Then you have hepatitis B virus that causes viral hepatitis, that is inflammation of the liver, and the advanced stage of that also is hepatocellular carcinoma, cancer of the liver. So look, taking HIV as an example here, HIV is a retrovirus. It is called a retrovirus because viruses can either be, they have either RNA or DNA as their nucleic acid, and you have what you call central dogma. That central dogma is just a process that shows, a biological process that goes on within the system, that shows how living organisms produces proteins or components of this that builds the system, and it goes from DNA to RNA to proteins. But in the case of HIV, it starts from RNA, then from that RNA go back to DNA. That is why it is called a retrovirus, and it has affinity for CD4 lymphocyte. These CD4 lymphocyte, they are important immune cells that are produced by our body to fight off infections. So it's just like you having soldiers to guide a particular territory, and the soldiers, they get killed in the process of fighting off foreigners. So once the defense mechanism, which are the soldiers, which are the CD4 lymphocytes, once they are being killed by this HIV virus, then it will make the body susceptible to any infection, and you call them opportunistic infection. So it is those infections that now overwhelm that individual, overwhelm the health of that person, and over time it leads to AIDS, which is the total absolute immune suppression of the immune system of the host. So another one is herpes genitalis, which is caused by herpes simplex virus, and it is characterized by multiple vesicles around the genitals, and these vesicles, they contain fluid, and they can break down to form ulcers around the genitals, even though they can heal on their own without taking antibiotics. And also another thing with herpes simplex virus, they also tend to go into latent stage, and certain conditions can reactivate these viruses. We have genital wart caused by human papilloma virus, and it is described with fleshy mass as a result of uncontrolled growth, and it is usually painless, and it can lead to cancer of the cervix, cervical cancer, especially in women. So the examples we have talked about, they are the examples based on etiological classifications. So next classification is what you call clinical classification. So this clinical classification is based on the presence or absence of ulcers or sores around the genital areas. And based on the clinical classification, you have genital ulcer diseases and non-genital ulcer diseases. By genital ulcer diseases, those are diseases with visible ulcers around the genitals. Examples include syphilis, chancroid, herpes genitalis, lymphogranuloma venereum, and granuloma inguinale. So these ones, you have visible sores or ulcers around the genitals, and that's why they are called genital ulcer diseases. So even though they are presenting with ulcers or sores around the genitals, so one needs to know the particular agent that is actually responsible for causing that infection, and that is why this condition, they have distinct or distinguishing features that can be used to classify them in the clinic. For syphilis, the number of ulcer is single. For chancroid, it is multiple. For herpes it is multiple. For LGV, it is single, and for granuloma ingulae, it is variable. Then the type of ulcer that are seen around the genitals. In syphilis, it is usually clean. In chancroid, it is dirty. Herpes, it is clean. In LGV, variable, and GI, it is variable. Then in duration refers to the nature of the skin or of the tissue surrounding the affected area. So in syphilis, it is firm. In chancroid, it is soft. In herpes, it is variable. LGV, variable, and GI, it is firm. And for pain, in syphilis, pain is absent. The individual will not experience or encounter any pain. In chancroid, pain is present. In herpes also, the person will experience pain. In LGV, it is variable, but in GI, it is very rare. Then you have enlarged groins around the affected area. In syphilis, it is present on pain. In chancroid, it is tender with abscesses coming out with pores. In herpes also, it is tender with no abscesses, no pore. In LGV, it is mild and tender. Then in GI, it is mild and tender. So this shows how a syphilis looks like. You can see that the sore there is just single. As earlier mentioned, the number of ulcer is single. So this shows a syphilitic ulcer. And you can see this is a chancroid. You can see multiple ulcers around the genitals. Also genital herpes, you can see multiple ulcers around the genitals. So now let's look at non-genital ulcer diseases. These diseases, they do not have ulcer around the genitals. That is why they are called non-genital ulcer diseases. One is gonorrhea. Another one is non-gonococcal urethritis or cervicitis. You also have genital candidiasis. You have trichomoniasis. You have bacterial vaginosis and genital warts. So this condition, they do not present with any visible ulcers around the genitals. Now, even globally, STIs, they are of public health importance, and because they spread easily from individuals that are infected. So individuals that are infected via engaging in careless behavior can easily transmit this infection to other people. In Nigeria, it is one of the leading causes of outpatient visits, and it has a prevalent rate of 9.3%, sorry. And this the burden of STI is further compounded with the advent of HIV. You know, HIV too is sexually transmitted infection majorly, and it can also be transmitted via other means. But because other sexually infections are also present, so it's making the treatment regimen very, very difficult. And the epidemiology of STIs involve the study of sexual behavior, and it can affect it mostly affects people of reproductive age within the community, and it affects anyone at any level in the society, and common among people of lower socio-economic class. Adolescents within the community, they are particularly prone to STIs because of peer pressure and the urge to experiment sexual activity. And people of poor socioeconomic class, they might want to use sexual activity in order to get means to survive or as a means of livelihood, and as a result, they are exposing themselves to infections. Example is commercial sex workers that use they mainly engage in sex for the gain of it, and married men also in polygamous setting that tends to seek financial assistance from other people outside their home that are not their spouse can also get infected. People in high socioeconomic class, can also be infected by engaging in extramarital affairs as a way of showing their affluence. Now, STIs can affect male, can affect female, can affect anyone at any time of the year. So it is not time specific or gender specific. It can affect anybody. And the female gender is more likely prone to STIs than the male counterpart because of the tendency to have their sexual experience at a younger age. And some female, it is not, they are not doing that willingly. Some are forced into early marriage, and as a result of that, they can get infected. Some occupations are risk factors, such as members of the armed forces, because most of the time they are separated from their spouses. Long truck distance, they are always on the move, they are always on the go. Also, salesmen, they are at the risk of contracting STIs because of their high mobility. They are always moving from here to there, and so because their partner might not be around, so they might want to satisfy their sexual urge, then engage in extramarital affairs that can put them at risk. Even people with stable marriage, where the couples are staying together, is a good strategy against the accusation of STIs. But husbands that are living far away, not only husbands, even wives that are living far away from their husbands, or husbands living far away from their spouse, they are prone to acquire STIs. Although some people are using poverty as a means or as a justification to engage in sexual activities so that they can get means to cater for themselves or means to sustain themselves, but it's even more dangerous for them because they are putting their health at risk. So poverty, which often coexists with low level of occupation, is associated with STIs, even though the disease is known to cause across all social strata. People with lower education, because they are not well informed. If they are well informed, even though they are engaging in sexual activity, they will know that, okay, I need to protect myself against this infection. But because they are not well informed, as a result of their lower education, can make them prone to STIs. Also, having multiple sexual partners is a guarantee of acquiring sexual infections, because you don't know what these individuals are carrying, and you're just engaging in sexual activity with them. And this association is further reinforced in the presence of ulcer. Even if you have ulcers around the genitals, open wound is a means to get infected sexually. So even though you are using condom or you are using a form of protection, if you have open wound around your genitals, you can still get infected. So let's look at signs and symptoms of STIs. It affects organs in both sexes, both male and female. In heterosexual male, that means males who practice penile to vaginal intercourse. The signs that are seen, we have urethral discharge from the urethra, and they often experience difficulty in passing urine, and you can see ulcers, genital ulcers around the genitals, as seen in genital ulcer disease. And you have lymph nodes. The lymph nodes around the genitals will be enlarged. In homosexual males that men having sex with men, you will see signs like rectal discharge. You see signs like rectal pain and bruises around the rectum. In heterosexual females, you have signs like foul-smelling discharge from the vagina, and this is seen in candidiasis. Also, you have difficulty in passing urine, and you could see genital ulcers or sores around the genital area, and some, they will experience vaginal itching. There are also homosexual females that tends to have sexual intercourse with another female, and they are using their other parts of their body, maybe the mouth and the likes, to sexually please the other person. And as a result, even the mouth is also a part that can be infected. So they are not excluded from these infections. So if female practice oral sex, whether with another female or with a male, they can experience difficulty in swallowing. Their voice can become hoarse and they can experience throat pain. So managing these infections, it begins with collecting the specific specimen, and that specimen will be examined will be examined in the laboratory in order to determine what is actually causing that infection. So before you can properly manage a condition, you have to know the type of specimen to collect, because somebody cannot be experiencing urethral discharge and you are collecting swabs from the mouth. That will not work. You have to collect the actual specimen that can give you the actual result. So for urethritis in heterosexual male, the samples collection can either be urethral swab or urine specimen, and that can be done for microscopy, or it can be cultured in the lab, or sensitivity test can also be carried out. For homosexual male, one will collect rectal swab for microscopy, for culture, or for sensitivity. For heterosexual females, the samples collection involves eye vaginal swab or endocervical swab, also urine sample for microscopy. And for females that practice oral sex, you collect throat swab for microscopy and for other examinations, clinical examinations. So it now treatments of these infections. There are different treatment modalities, and this includes prescription of oral drugs to be taken by the patient depending on the symptoms that are accompanying this infection. And this is to ensure that this patient, they complied with the time and the dosage of the medication, and also to prevent the development of resistance. And for recommended drugs for the treatment of gonococcal infections, you have a quinolones group of antibiotics such as ciprofloxacin, ofloxacin, and pafloxacin. The fact that these medications are being mentioned here is not a justification for anyone to go get them and medically or self-medically treat yourself. If you are experiencing any signs or any symptoms, the best thing is to see a doctor so that you can be properly diagnosed and you can get the correct treatment. Self-medication is dangerous. Okay? So oral doxycycline is used for the treatment of non-gonococcal urethritis or cervicitis. And for vaginal candidiasis, you use topical clotrimazole or nystatin vaginal cream. Oral metronidazole is to treat trichomoniasis, and cotrimoxazole are effective for chancroid. Another key important thing in treating STI is that you have to treat both partners at the same time, because if one person is just treating the infection, the person can still come back to contract the same infection from the partner. So if if one person is treating infection and you have partners that you are sexually engaged with, it is important that you treat those people, that partner, at the same time. And this is to ensure eradication of the pool and to prevent reinfection. Also ensure proper and adequate management of STIs in order to eliminate disease transmission in the community, and it is very good for routine screening for STI, especially among high risk population, because they may serve as reservoir of infection. Example, you have commercial sex workers. And it is very, very important to practice good sexual behaviors by abstaining from premarital sex, and also encouraging monogamous sexual relationship, and to discourage people from risky sexual habits. Treating these infections, yes, there are treatments to treat this infection, but not having the infection at all is a beautiful thing. So abstinence is just the best thing to do. If you are not married, please abstain. So also, to those that are married, be faithful to your partner and use protection, use condom if you are engaging in premarital sex or extramarital sexual relationship. But there's nothing as beautiful as, abstaining if you are not married, or sticking to your partner if you are married. Thank you for listening.